Okay, good morning, good afternoon, good evening, everyone, and welcome to today's webinar, which we are using to launch our digital content repository for family planning. My name is James Kiarie. I'm the head of the Contraception and Fertility Care Unit here in WHO. And we are really so thrilled to be joined by a panel today of dynamic experts and partners who really bring a lot of deep expertise in health communication and digital health implementation. We have panelists from both within WHO and also from outside the WHO. Many of you probably know that this is the part of a broader set of sessions that we'll be having on navigating truth in a changing world. And in these sessions, we explore how digital transformations intersect with public health rights and trusts. And probably many of you joined our last session, which was in April, that we looked at unpacking the landscape of misinformation in SRH. And what we are doing today, we will take a practical next step. I think in the last session, we discussed what are the issues, but what can we practically do about this? So how do we ensure that people have access to accurate, trusted family planning content, and that this content reaches people where they are? Particularly in this time, where digital spaces have become both a source of opportunity and also a place of vulnerability in terms of truth. How do we ensure access to high quality, trusted information? And this is more critical than ever. This repository is designed to serve as a shared resource for health providers, for governments, civil society, and for others who use digital platforms. And it is also supposed to empower partners to deliver evidence-based content. So for today's session, we'll walk through the rationale, development, and potential uses of the content repository, as well as learn about WHO's broader work in this area and hear firsthand from digital content creators. So welcome everyone. We are really happy to have all of you. And before we start, if we can move to the next slide. Yeah, we've already discussed, so we are really proud to have the panelists that we have today. And we'll start off from hearing from our own colleagues here in WHO. And I think over to Andy for the next presentation.
Thank you, James. And maybe just before we go to Andy, just wanted to quickly add in some quick housekeeping that the webinar will be recorded and hopefully you have all consented, and that we do have interpretation both in French and Spanish. And if you can kindly go to the interpretation globe icon, you will be able to see the different rooms. And we have a chat and Q&A, so you can be submitting questions through the Q&A box. Thank you, James, and hand it back to Andy.
Hello, everybody. Good morning, good afternoon, and good evening. Pleasure to be here today. Thank you very much for the invitation, Tigist and team, and welcome to everybody in this session. Next slide, please. So my name is Andy Patterson, and I'm the team lead of digital channels here at the World Health Organization in Geneva. And our job is to basically get more health messages, guidance, and recommendation to more people through more channels so that they can make better health decisions. And hopefully, and ultimately, their goal is to get them to live healthier lives. And that's what we all want. In my team, we're less about reach and more about behavior change, which is tricky to measure, but so much more important. Next slide, please. We work in our team on three different pillars The first is to raise good content. The second is to fight misinformation. And the third pillar is to gain user insights and try new tools. I'm very lucky that we are able to try tools to see if they work to advance the WHO's public health mission. You obviously all aware that the internet is an amazing thing and social media is incredible, but at the same time, it also brings some risks. And one of our jobs is to think about this digital balance. And a lot of misinformation is on social media platforms. And one of our key jobs is to fight that misinformation. But at the same time, one of the ways that we do that, as I said, is to raise good content, whether that's from WHO, the ministries of health, or trusted partners around the world. The reason we do that is because misinformation thrives in a vacuum. Next, please. So more and more people are turning to the internet for health advice, which brings with it the risks that I've just said. And I think for the first time this year was the first time that more people searched on social media platforms and apps than they did on the internet itself through Google. So in the past, we've made a lot of effort to make sure that our content is surfaced on Google, not just with search engine optimization, but working with Google and other search engines to promote content to the people who are looking for it. Credible sources of health information is something that we really focus on. Of course, now with more and more people searching health information on social media, we are also working with these platforms to make sure that the content is surfaced, whether it's from us or the local health authorities. Next slide. And sadly, some of the figures which have come out from the Edelman Trust Barometer, which if you haven't seen it, I encourage you to go and have a look at it. If you just search Edelman Trust Barometer, you'll find it. The latest findings show that a lot of young people have made bad decisions when it comes to finding content online and then following the advice of it. So it says here 43%, which is a shocking number, have made this decision poorly. So next slide, please. And today I'm going to tell you about 3 projects that we run in our team, the Health Claims Platform, chatbots and channels, and also the FIDES network of influencers. And I'll start by telling you a little bit about the Health Claims Platform. So the Health Claims Platform is a repository of content which we hope to launch in the next couple of months. It will have different topics within that. This allows, the target audience is twofold. The ministries of health themselves and the technology companies and social media platforms. The idea is it gives them a place to come and check if a fact that they've seen on the internet or on their platforms is correct or not. And the way that we've done it is we've packaged content out there so that we can say, when it comes to vaccines, here's the truth about vaccines. But it's also a platform where social media companies can ask questions or surface new questions about content they're seeing. As you know, misinformation is moving very quickly. Misinformation is very easy to create. Creating science behind it to debunk that information is much more complicated and lengthy. This platform is hoping to reduce the time it will allow platforms to get information and therefore make better decisions on what they promote, what they raise, what they reduce, or what they remove. Ultimately, we're hoping to have safer platforms for everybody. Next slide, please. Chatbots and channels. We have millions of users across our chatbots and channels, and we've reached nearly every country on the planet has at some point had somebody in there on one of our chatbots and channels. So from our point of view, chatbots and channels are able to reach people literally in the palm of their hands, and that's so important when people are too busy and want to just check the facts. It allows them to know that everything on our channels and chatbots are from credible sources of health information. We have not just on WhatsApp chatbots and channels, we've also got Viber, we've also got Facebook Messenger. We're exploring Telegram and Signal. The only thing stopping us is resources at the moment in these spaces. The tricky thing with these things is keeping content up to date and making sure that people are engaged with it. So there's quite a bit of effort, certainly when it comes to chatbots, to keep people and remind them that the chatbots are in use. Next slide, please. So we launched early on with the COVID-19 chatbots. Obviously, we've been running those for 5 years. COVID-19 has taken very much as a back burner now. A lot of our content is about health promotion. What is health promotion? For those that don't know, it's basically move more, eat better, don't drink and don't smoke, and look after your mental health. Health promotion affects everybody, whether you're healthy or unwell. And so this is a good way to make sure that people is relevant to everybody who's accessing this information. We're obviously a trusted source, a digital voice in the noise that people recognize and that people respect. And the WhatsApp channel that we launched I think about a year ago now, has 9 million users at the moment. If any of you are working in organizations or ministries of health and are thinking about how to reach populations, the WhatsApp channel is a zero technology way of reaching people and has proved successful for us. We've actually written a small document, if you're interested, to please contact us, a small document on how to set such channels up and what our recommendations are on how to run them. We're calling these kind of documents playbooks or toolkits to allow people to get that content out of there. Talking about toolkits, we are launching content repositories, such as the one we're talking about today on sexual reproductive health. We have them on smoking cessation, and many other non-communicable diseases. But today, to support the launch of this toolkit, we're looking to see how to create toolkits of content which member states and ministries of health, NGOs and trusted partners will be able to take our content and with a small amount of modification, have a ready-made product, make it localized, make it more relevant to them, include their slogans, obviously, and their strap lines for their communication messages, but with the knowledge that they don't have to reinvent the wheel and this content is there for them. When it comes to actually chatbots, we're actually also giving the dialogue flow with regards to that and programming in several different formats to allow people to maybe reduce their workload of creating a chatbot by between 50 and 80% of the effort. In exchange, what we ask is that if people have used our content, that they put that content back into the community because they may have localized it and maybe a local NGO to them could reuse it and save themselves even more time because it would be more relevant to their market. Next slide. FIDEs. I don't know if any of you have heard of FIDEs, but hopefully you'll have seen a lot of our creators as you've been surfing on social media. We have a group of about 1,300 creators who are all healthcare professionals, and we're calling them trusted voices. Fides is the name of the Greek goddess and Roman goddess of truth, and we thought that would be a nice name for the project. It's also where we get the word bona fide from. So Fides is this network of, as I said, 1,300 creators. We have well-established creators on one hand who have got large followings, and we have a smaller group of people who want to get on social media, who are healthcare professionals, and we help them on board and also train them with masterclasses from both experts and platforms, as well as communications professionals. The idea is that every week we send these people content and we say, if this content resonates with you or your audiences, please go ahead and create content and push it out. The idea is that we coordinate so that there are more and more people speaking about the same topic at the same time. And with these people, they're not our ambassadors. They don't speak for us. A lot of the time, you won't even know that they're part of the community, but they are trusted voices. I think more trustworthy than anybody else on the internet, because you may know that people trust their governments and health services a certain level. Usually above that, in a lot of countries, they trust their press, especially if it's a free-thinking press. That was hard to say. Of course, above that, they have their friends and family, and who they trust the most are influencers. In amongst that influencer group, the most trusted group of people are doctors, nurses, and other healthcare professionals. So with some of the most trusted voices on the internet are carrying WHO recommendations, guidelines, and more importantly, messages. Today's toolkit that we're talking about is going to be very useful for us in getting this content out to this community when it comes to matters of sexual reproductive health. Next slide, please. We work with the tech industry a lot. So you'll hear from my colleague Dia shortly about social media at WHO. My team focuses on working with private sector. So we work a lot with the platforms, a lot with tech industry, a lot with thought leaders and think tanks to see how we can better tackle as an industry as a whole, as across a multi-sectoral industry, on how we can tackle some of these important matters. So what we do in the Tech Task Force is bring together roundtables. The most recent one we had was talking about AI-generated health misinformation and disinformation. And we're talking about this from the point of view of identifying the content, labeling the content, all the way through to actually AI tools which could help identify misinformation. The idea of this working group, which will carry on for at least another 18 months, is to get very good at stopping misinformation going viral rather than get very good at bringing it down once it's gone viral. So we're really trying to think of how we can convince the technology industry, the social media industry, on how to improve so that people have happier and safer experiences on social media. Next slide. So I've sort of given you a quick overview of how so of these three projects, it's one of about 3 of about 8 projects that we run in the team. But the idea is that toolkits like we're discussing today will be vital in all of these cases. We will put the toolkit within the health claims platform to allow social media companies at any time to check whether the content that they're seeing on their platforms is correct or not. We will be building chatbots and channels with this content, including dialogue flows. And we will be talking about this in our roundtables with regards to content validity. Really important is over the coming year to watch the number of toolkits that we'll be producing, which will of course be open to use everywhere and hopefully save people's time and effort to get content out there, which in turn together will save lives, which I think is pretty cool. And that's it for me. Tigist, back to you.
Thank you so much, Andy. And it's always enlightening to hear what's going on in WHO, even for me working within WHO. Thank you so much for that amazing presentation. I will hand it off now to Dia Banerjee, who we're very fortunate to have from the WHO Communications Department leading the social media team. So Dia, over to you.
Hi, colleagues. It's really lovely to be here, and thank you to Jest for giving me a chance to also explain some of the best practices in WHO in terms of relaying public health messages through creators and the work we do in the social media team. So I lead the social media team. Like Andy said, his work is more relevant for behavior change, and it's very difficult to map indeed, but our channels reach about 74 million people across the world, which is a huge audience capital. But more and more, we are trying to speak a very of the person, like how do they access information about sexual health, mental health, vaccines, infectious diseases, and really make the message resonate and relevant. Next slide. So I'm going to start with a very simple sort of like a story. Like this kind of inspires me. If you read what's on the slide, that in the 18th century opera Magic Flute of Mozart, one of the main characters was considering suicide because he lost the love of his life. And 3 characters showed him that there are other alternative ways to solve your problem. Next slide. And this particular phenomenon, if you kind of, is known as the Papageno effect. So the Papageno effect is this based on this character who was considering suicide, and how social media posts of hope, healing, and recovery can really influence the audience to consider an alternative path. So this is what even influencers to a large degree do. When we work with them closely, they are able to deliver the message in a vastly different way than somebody delivering from a brand or a logo, which is the World Health Organization. Next slide. So we've done some work with very many influencers, both with Andy's remarkable FIDES cohort of medical influencers, but also with non-medical influencers. These are 3 short examples. I won't play them. You could watch them once you have access to the PowerPoint. So we partnered with, let's say on World Health Day, one of the topics we unpacked was access to menstrual hygiene products. And we saw this school teacher who was, she was talking on her TikTok channel about access to menstrual hygiene products for low-income students, so that young girls don't drop out of schools and they are able to access these products and attend school. So she did a video about access to menstrual hygiene, as also it's about removing barriers to health. And that video worked really well on our channel. It was something different that we had done. This was the early stages of our creator activation work. Then this particular gynecologist based out of the US, she gained a lot of fandom during the COVID days. She basically did not practice. There were, of course, as we all know, restrictions put on by countries. So what she started doing is creating educational content about very many issues in the realm of OBGYN, basically on gynecology and women's health. And we partnered with her to kind of talk about abortion as healthcare. So on Safe Abortion Day, she was actively partnering with WHO on our Instagram and TikTok channel and talking about the myths, debunking the myths associated with abortion. Next slide. Now, what we also do is we try to speak a language of our young audiences. And we thought that when we were comparing in our message testing, that when we put out a particular social media content that has a very WHO-esque language, which speaks like an institution, it had a lesser impact compared to somebody who's lived through an experience and talks about, let's say, the harms of vaping. So this is Haibi. She's also an influencer, and she's a young woman, I think living in the States, who basically cataloged on her TikTok her quitting journey, quitting e-cigarettes, and the remarkable impact it had on her health, and how her quality of life, her breathing, everything improved, and how it was a struggle for her. So we brought her onto the WHO TikTok and Instagram channel and asked her to, basically, we gave her a set of messages, which is our institutional messages, lists out what are the harms of e-cigarettes, and we told her to make it her own, to basically not dilute her personality or the way she does her videos, but kind of enthuse her personality in our messages and talk to our audience. And lo and behold, this strategy really worked. And we've been implementing this strategy very actively with creators, trying to kind of give them a pitch deck, explain what our messages are all about, go through their scripts, do very light tweaks to ensure that it's absolutely on message, it's scientifically correct. And we then basically ask them to shoot it in their own style, and we package it and produce it on our channel. And the way these videos are working, a lot of young people remix these videos, add commentary, share with their friends and families. And that's the ethos of social media right now. Everybody is looking at a point of connection where they can share credible, trustworthy information that does not seem like propaganda to their friends and families. And that's the success in partnering with creators, which we activate. So these are some examples. Then there was a mother who was explaining about how her son landed in the emergency room, and vaping almost cost her son's life. Then this particular mathematician, Hannah Fry, she's extremely popular. She does science and mathematics videos. She's also a professor in the University of Oxford. And she had a lived experience about basically how she missed her pap smear screening, and she kind of relays the importance of testing and screening to detect cervical cancer. And this video also reached millions of users. It really resonated. It was done with very frugal filmmaking techniques. She basically was in her bedroom and shooting, and we just lightly packaged it. So these are some of the styles we are trying from a WHO institutional standpoint to demystify some of our technical topics and be closer to our audiences. Next slide. Now, one thing that is really unique, and I feel very proud to cite this example, and it's a really simple example. During the peak days of the COVID-19 pandemic, Dr. Tedros tweeted to the K-pop band BTS, basically congratulating them about their advocacy about wearing a mask, where they did a small video about in the early days of COVID about what are the precautions people need to take against this virus. And it became one of the most retweeted posts of Dr. Tedros till date, or one of the most shared posts of Dr. Tedros. So when you speak a native language of fan base, or when you leverage a cultural moment, there is a point that gets very interesting in health communications in terms of reach, how you really expand that message and its resonance among very many fans who come from different parts of the globe with different ideologies. So I would really encourage you to read a case study about this tweet and very many such examples cited in this paper about how fan-based culture can also kind of turbocharge your science messaging. Now, on another note, on mis and disinformation, we are trying very many formats, very many ways of speaking to public audiences. And why we are doing this, like Andy just spoke about the Edelman Trust Barometer, in the latest 2025 Edelman Trust Barometer, which is a special issue on trust and health, you can see that people are trusting their doctor first and then their friends and family. So we have to be cognizant that in the trust, this kind of scale, who are the people who are being heard more? So when you partner with medical influencers, you kind of elevate science messaging, but we also have to work with the influencer to kind of strengthen their messaging and strengthen their advocacy. And with friends and families, we work with non-medical influencers who have lived experience, like I cited the example of Heidi, who spoke about her quitting journey around vaping. Next slide. And I promise this is the last one because I didn't prepare much, but I hope you gain something out of this presentation. Now, this is also something to take into account, that the average person thinks, like younger, like basically they know as much as a doctor. So when you are working with this kind of a variable, it becomes, we have a skin in the game as health professionals, as health organization, to really be on social media and connect with our younger audiences. Because the fact of the matter is, if you look at the Reuters School of Journalism report that released, I think, 2 weeks ago, social media is the primary driver of people getting their news. It is no longer legacy media. And if a younger person is responding more, is kind of confident that they know as much as a doctor, we have to be on these digital channels, whether it is social media networks, whether it is messaging networks, and relay our advocacy on science, on public health, and speak that language of the layperson. So I will leave it here. And I hope if there are any questions, I will have to unfortunately exit this webinar because I have other things lined up. You can reach out to me by email or through social media, and I will do my best to respond to your queries. Thank you so much.
Thank you so much, Dia. That was excellent and really inspiring to see how you guys are interacting with creators. So thank you, and we'll hold off any questions for you. We'll be able to forward it to the addresses that you provided. Just in the interest of time, we're going to move quickly to our next presenter, and very happy to present Dr. Fome Ikogo, who is actually going to be helping us launch the toolkit and content repository for digital client-facing systems. This is the main attraction, I think, why we even decided to host the webinar. And I will hand it over to you, Fome. Thank you.
Thank you. Thank you, Tigis. And it's great to have an opportunity to contribute to this conversation and then introduce the toolkit and content repository. So I'll like by stating why digital platforms matter so much for sexual and reproductive health. First of all, as we have discussed, as Andy and as Dia have discussed, it offers convenience. So a lot of people have access to these digital tools, and this is how they access information. So young people, especially, for them, this may even be the only way, the only point of contact with sexual and reproductive health information. Another reason is that they offer a sense of perceived anonymity. So for a topic like sexual and reproductive health or contraception that is considered sensitive, the fact that these digital channels are anonymous really helps people interact with them with these platforms. Also, they help overcome stigma. there's a lot of stigma associated with SRH discussions. So these platforms create a channel or a space where people can explore, they can ask questions, they can make decisions, and all this can be done without judgments. That's not something that you usually see in a face-to-face setting. So this makes digital platforms a powerful enabler of access to SRH information. Next slide, please. So, of course, with these opportunities that digital channels pose, there are also challenges, some real challenges, especially when it comes to the content for family planning. The results from a recent study that was done showed that, so this study was to assess the family planning content in some digital self-care platforms, and there were significant gaps in the quality of the content, in the accuracy, in the comprehensiveness. So some of them had some information, some of them did not. So that was a very significant finding. And another major challenge with family planning content is misinformation. We've spoken about it, Andy and Dia has spoken a bit about misinformation. Even in traditional spaces, family planning has long been surrounded by myths. So you have people saying the pill will make you infertile, vasectomy will make you impotent. There are many myths that abound about family planning methods. But in digital spaces, this is even a bigger concern because information spreads very rapidly and it's not always verified. And the risk of it becoming viral is far more amplified than in traditional settings. Also, we have people who have norms and they have values that shape how content is presented and how it is received. So what works in one context may not necessarily work in another. So that a one-size-fits-all approach doesn't work when providing content to users using digital spaces. People have different needs, they have different experiences, they have different motivations. So it's important that the content is tailored accordingly, whether the content is geared towards young people, towards older people, postpartum women, married couples, or even people who just have specific concerns about the side effects of the method or, compatibility with them, eligibility for the method. It's important that this content is tailored so that it can be effective. Next slide, please. So another thing that is very important to remember is that people don't just consume information. Things have evolved with the way people interact with information. They curate their own digital experiences. So users, especially when they use social media, they train their feeds and their platforms to show them the content that they want. So that means that we, the WHO, we can't just rely on putting out more content and hoping that it will reach the right people when they need it. We've heard a bit about how people access information. So it's important that we understand how users search for this information, how they engage with it, and how they evaluate this information online. And we're able to meet them in their user journey and bridge the gap kind of between the source of the information and how these users will eventually get to interact with this information. This could mean refining our messaging strategies as we have been doing with the engagements with social media influencers, partnering with different platforms as we're doing with the tech task force, and even just ensuring that our content is optimized for how people are searching, which are some of the ways that WHO is trying to address these issues. So it's basically about being audience aware and being responsive to the users as the digital ecosystem evolves. So with all of this, first, we need to leverage the potential of digital spaces. So these platforms offer real opportunities to share reliable information that is evidence-based and also to counter misinformation. But at the same time, we have to be realistic. The digital space is informal most of the time. It's often fragmented, and user engagement is quite sporadic and could be unpredictable. So that means that our approaches have to be adaptive, they have to be timely, and they have to be grounded in how people actually use these platforms. So validated content like, the one we're going to be introducing today, the content repository, we believe it can help bridge this gap because it allows us to offer trusted information that's both accurate and adaptable while still in a way respecting the informal and dynamic nature of engagement with digital platforms. Okay, so now introducing the toolkit and content repository. So this toolkit was developed to support the digital client-facing family planning platforms to provide reliable family planning content that is also user-friendly. So it's not the technical content that we're used to from WHO resources. This is more user-friendly, more digestible content. So this is to ensure that people who are accessing family planning content through digital platforms are able to receive information that is simplified while still being grounded in WHO recommendations. So this content repository is evidence-based, it is adaptable for use across different digital tools. So it is not tool specific. So it's content that can be used on apps, that can be used on social media platforms, can be used on websites, used for SMS messaging. And we hope that it's something that would support informed decision making around contraception and reproductive health. And it's something that would also help platforms to validate the accuracy of the family planning content. So there are I'd just like to highlight two key components. So we have the toolkit, which is kind of like an implementation tool. And then we have the content repository, which is an essential and integrated part of the toolkit. I have kind of mentioned the content repository a couple of times. And together, it offers a comprehensive package that we hope will support digital platforms to deliver reliable and validated family planning information and also counter misinformation. Next slide, please. So before I go into a deep dive into the toolkit itself, I want to briefly highlight where it fits within the broader digital health ecosystem. So this toolkit supports the development of digital client-facing tools for family planning. And this is by providing the health content. This part of it is one of the key building blocks when planning a digital health intervention. So this is alongside things like digital health applications and having enabling structures like governance, infrastructure, and policy. So overall, all of this come together to contribute to designing a content and delivery strategy. Next slide, please. So now we're going to take a look at what is inside this toolkit. There are 4 main components of the toolkit. First, we have the health interventions and recommendations, which is essentially a repackaging of WHO guidelines. And then we have the user scenarios. These user scenarios illustrate how different personas may interact with one another while using the toolkit. And it's helpful to understand the possible user experiences that could be had when engaging with this resource. Then we have the content repository, which is an integral part of this resource, and I'll focus on that a bit more shortly. It provides a simplified and adaptable and evidence-based family planning content that can be used, as I mentioned, across a variety of digital channels. And then we have indicators and performance metrics, which these are just illustrative metrics that can help users of this content repository to track their platforms and monitor the performance of their digital tools. The toolkit also includes some implementation and contextualization guidelines, some general guidelines that could support people when using the toolkit and when adapting the content to suit their own platforms as well as their own target audiences. Next slide, please. Okay, so I'm taking a closer look at the content repository itself. It is organized by family planning methods. So the focus of this is this slide, thank you. So the focus of this is the commonly used methods. So the methods that are commonly used across the world, such as oral contraceptives or the pill, implants, condoms, fertility awareness methods. And for each method, the repository provides content across a set of standard dimensions that apply to most of them or all of them, and it can be used to, this ensures that the messaging is consistent and it's clear across the different methods. So it includes things like general information about the contraceptive method, how effective it is, for how long it works, what are the side effects, how do you even manage the side effects both at home and when do you need to seek expert advice, who can use it, who cannot use it, what are some of the health benefits or even risks associated with these, and when and how you can even use this method and the role of the partner in decision-making around this method. So this content, like I've mentioned, is user-friendly and is something that can be easily adapted across different digital channels. The goal is to ensure that wherever people are seeking information, they're receiving information that is accurate and is consistently accurate, which is very important, and the information is relevant to their context. Okay, so this is just a quick snapshot of what the content repository looks like in practice. This example is of the pill, combined oral contraceptives. And the content is structured under different categories to guide how it can be used in digital tools. So this ranges from, like I mentioned, the general information to guidance on who can use it or who cannot use it. And as you can see, I don't know if you can see this clearly, the language is simple, it's user-friendly, and it ensures that it's accessible for a broad range of users. So you don't need to have a health background to understand the content the way it is presented here. Anyone can use it, anyone can understand this, and then contextualize it for their target audience. And at the end, even while all of that is done, as much as it has been simplified, it is still medically accurate and still is still consistent across the different WHO resources that talk about the subject. Next slide, please. So there are three primary scenarios of use that we anticipate for this across digital platforms. So one of them is for platforms that you just want to create family planning content. You don't have anything that you don't have anything to use as a knowledge base. So if you are looking to develop new content from scratch, this toolkit can serve as a foundational resource or a knowledge base or a reference point for developing the content. And then another way it can be used is to enhance content. So for those that already have existing family planning content on their different platforms, the repository can help you review that content and then see how you can improve the comprehensiveness, the clarity, or the alignment with WHO guidelines. As I mentioned earlier, this is particularly useful because studies an assessment that was done showed that there were inconsistencies in some platforms that are currently active, some digital platforms. So using this could help enhance the quality of the content, family planning content on these platforms. And it's also important to use that, it's important to highlight the importance of this toolkit for fact-checking and validating information that is shared on channels. We've talked a bit about misinformation. This is a resource that you can easily refer to confirm whether the information that you're saying is actually accurate or if it's aligned with WHO guidelines. So across all of these use cases, there's an opportunity, and this is very important to contextualize this content. So this is a starting point. We don't expect that the content as it is presented here will be relevant for every audience, for every tool, for every context. We expect that there should be some translation or even transcription of the content. So adapting not just the language, but also the tone, the examples, the cultural references, so that it resonates meaningfully with the local audience that the user or the implementer is going to be working with. So this versatility, the fact that it can be adapted across different audiences, across different platforms, is what makes the repository a practical tool. And it means there are different entry points for this. So whether you're designing a chatbot, a website, whether you're interacting with any audience, there are different entry points for utilization of this toolkits. Next slide, please. So finally, it's also important to look at how this content can be paired with emerging technologies, particularly AI. We'll be remiss if we don't talk about AI. So there are three promising opportunities. First is with retrieval augmented generation. So we can use this repository to train or refine AI tools. We know that not everyone might use it in that way, but that's also something to consider, to refine AI tools like chatbots and ensure that they deliver accurate and evidence-based responses. Another way it can be used is through AI-enhanced personalization. So this can be done to help tailor the content to meet the unique needs of different users. So whether they are adolescents, older women, married couples, whoever is using it, AI can help to support the personalization of the content. There's also the part of social media listening. So insights from social media can be used to respond with verified content that is drawn from this repository, and that could help combat misinformation in real time. So all of this points to the future potential of the toolkits, which we hope will be an evolving resource that evolves as things evolve within the digital space. It's something that we hope will be dynamic and evolve as the digital landscape changes. Next slide, please. So before I wrap up, I would like to thank and acknowledge all the stakeholders who were part of the scoping review. Their scoping review informed the development of this toolkit, and your combined efforts and contributions helped to bring us to where we are today. So thank you all. And now I will hand over to our panelists to continue discussions on user engagement on the different platforms that they manage, content generation challenges, and some of the best practices and opportunities for leveraging the toolkit to enhance family planning content. Thank you. Over to you, Tigist.
Thanks so much, Fome. And yes, we have officially launched the content repository and toolkit. We'll share that over email after the webinar. But I'm very pleased and honored to be able to welcome the next panelist, Terry Gachi, who is the country director of Love Matters Kenya and has a wealth of experience in actually using these types of digital tools. Over to you, Terry. Thank you.
Thank you, Tigist. Definitely honored to be here and be part of this conversation. And as Tigist says, I work with Love Matters Kenya as a country director. We use digital media to disseminate and engage on matters sexuality and sexual reproductive health and rights. Can go to the next slide. Yeah, great. Yeah, so Love Matters Kenya is a digital media platform that operates at the intersection of sexuality and sexual reproductive health and digital media. And we target young people between the ages of 18 and 35. But we live at a time where younger cohort of young people have access to the internet. Therefore, we get their engagement through comment or the inbox. But because of legal restrictions, unfortunately, we cannot engage with them directly. There has to be a mention of a guardian. But what we've done to bridge that gap is developing alternative models where now we are empowering parents to actually navigate these conversations from the comfort of their homes, and also acknowledging that parents wear different hats. They are the policymakers, they are the religious leaders, they are the teachers. So therefore, empowering them means that we are actually also having impact in other spaces. So we have a large percent of our audience are from urban and peri-urban areas, and this could be, for many factors, including good infrastructure in, urban and peri-urban areas compared to rural areas. And one of the things about our platforms is that information dissemination is not an end to itself. We also provide linkages to healthcare services through geolocators and moderation through a human being. Next slide. Our digital presence, currently we are at over 2 million audiences across our digital media platforms, which are Instagram, TikTok, Facebook, Messenger. We also have a website, and we're in the process of developing a chatbot, and our engagement range between 9 and 15 million. And I'd like to echo something that Andy said, that it's not always about the numbers, it's about the behavior change, right? Again, information is not an end to itself. What do people do with that information? Two things I'd like to highlight here about the digital presence. We go where audiences hang out. And I think one of the speakers mentioned that sometimes innovation is actually seeing how your interventions can fit into already existing spaces. And that's why I think you see most of our platforms are already what has been generated, because people are hanging out in those spaces. The other thing I'd like to highlight on this slide is we acknowledge that the Terry on Facebook is a bit different from the one on Instagram and TikTok. Therefore, the personas are very different, and it's something very important to notice as a digital media implementer. We are different people. When you switch from Instagram and TikTok, there's a switch in terms of the expectations or on what kind of content you'd like to engage in. And also we provide private and anonymous spaces where people can engage. While we want people to just enjoy and be honest, open, honest, and be non-judgmental as an implementer, you also have to acknowledge that people are at different spaces in their journeys when it comes to their comfort with SRHR topics. Therefore, providing private and anonymous spaces is key. Next slide, please. Something that we have to acknowledge, we've come a long way, right? People used to access information through our websites, but now we have social media where the attention span, people just scroll on if you don't get their attention. Therefore, we are very keen on thinking about what their needs are, but what are their wants, desires, and preferences? But more importantly, what are their values? Because you lose people as well if you don't acknowledge their values. You have to understand, what do they believe in? What are these values that guide their everyday life? And that way you're able to develop or package content in such a way that connects with their everyday life. And hopefully with that, incrementally, they can actually progressively get to the other side where they are rights-based and more progressive in their thinking. Next slide. So these are some of our approaches that we use, and I'm not going to go through every other point because it's here, and I'm hoping everyone can access them. I'm going to highlight just a few under each. In terms of in-depth understanding of adolescent and youth issues, for us, it's not just about the numbers. We want to understand, what do people feel about certain topics? What is their level of knowledge of certain topics? What does their everyday experience look like? And in that way, we are able to get an in-depth understanding and tailor communication solutions in a way that connects with their life. The other element I'd like to highlight under the in-depth understanding of their issues is the partnerships. Understanding that we cannot do it alone. You give someone information, you expect at some point, if necessary, they'll access healthcare information. Who are the healthcare providers? Are you in contact with them? Are you learning from them and also informing them of what young people expect when they come to the facilities? And it could also be government, could also be advocacy organizations that are in the space, because as well as we have to acknowledge there are still gaps, but that doesn't mean that we can stand still and wait for things to be right. Sometimes we just have to push buttons for things to happen. In terms of the customized and scalable solutions, I'll highlight a few things as well. Sex positivity is very important because when you're talking about something as fact-based as family planning, it's easy to just share content as has been shared by the tool, but at the same time, you have to connect it with other issues. When you're talking about family planning, one of the reasons why people are on family planning or contraceptives is because they're having sex. So just being able to be very progressive about sex and sexuality and then being able to connect it with maybe fact-based content work best. And then the bite-sized content, it's social media. There's only so much you can fit there. And one of the things that we do is provide that bite-sized content in small bits, but at the same time being keen to make sure that we are providing more context. Therefore, when using social media as an implementer, using the reels or stories to provide more context into conversation is very important. The other point under this I'd like to highlight is the live sessions. And this is where we get to invite medical professionals such as doctors or nurses or community health promoters who serve two purposes. First, we want to normalize conversations around various SRHR topics, including family planning. But more importantly, we want the doctor to be a bit more approachable because, young people sometimes don't want to go to the facility because they're afraid of talking to the doctor. But when you have these live sessions and they're able to engage with the doctor and have fun and get correct information, then create a space where they can comfortably engage with healthcare providers. And then the downloadable materials, they are specifically for our youth advocates who operate offline. We acknowledge not everyone has continuous access to the internet. Therefore, just seeing how the people who operate in offline spaces to educate others can access these materials and actually use them in offline spaces is important. And our key approaches, I'm going to highlight two things. The first is behavior change. Andy has mentioned the provision of information is not an end to itself. It is, we want people to change their behavior and make better decisions about their SRHR. The other thing is the use of humor. There comes a time when you have to tactically use humor to actually engage people because you have to diffuse tension. Some topics are a bit more sensitive and people consider them taboo. So how do we use humor to attract people and also engage them, make them feel comfortable when you're engaging in things that they don't necessarily are comfortable with? And finally, is collective responsibility. I think Fome has mentioned, we want to see what is the role of a partner? Traditionally, family planning has been seen as something that only women should be in charge of. But now we're in a space where also men and other, people should be part of this conversation and should be able to offer support or even take leadership in it. Next. The main challenges, really, I think the word cloud tells a very clear story of the main challenges we are facing. But I'd like to highlight from, the some of them that we face, it's opposition. Sometimes opposition comes from various levels. Could be government, like now we cannot access young people who are below 18 years, but sometimes opposition is based on certain topics. People can be comfortable when you're talking about maybe love and relationship, but when you introduce the concept of family planning or contraceptives, then sometimes people push back because of cultural and religious reasons. And this ties to the topic of censorship, where when you talk about censorship, we only think about the tech giants such as Meta and Google, but sometimes censorship actually comes from the people you're serving. If you post something they don't agree with, they can't post. And then if there are a number of them, then the post is taken down, right? And then there is the sensationalization of certain topics. Something happens like femicide, which is very serious, and then the gossip media takes that and runs with it and makes injects entertainment in it. So in that way, it dilutes the message. And sometimes, as people implementers in the space, you want to take that opportunity to actually pass a message, use it as a reminder that people should actually be, have certain attitudes towards certain topics. But gossip media, which is loud and they have a lot of influence, sometimes they take that. And then the recurrent misinformation, and sometimes it comes from just the comment section, because the post itself does not tell you the real story. The real story is in the comment section and the inbox. And sometimes the misinformation in the comments is so high. And if you have a platform such as ours where there are thousands and thousands of comments, it becomes a bit, challenging to follow each one of them. But I think this is where platform technologies such as AI are coming in. And finally, something I want to highlight is the politicization of family planning and various SRHR topics. Politicians will come and say, give birth to more children so that we can have more voters. And well, that seems like a very small statement. It's very powerful, and it can influence decisions, because sometimes it comes with small incentives, such as, some money or some small incentives for them. Some considerations or things to consider when creating content. It needs to be data driven, and I think we've talked about the various tools you can use, including just listening to what your audiences are talking about in the in your specific platforms, and also consideration for data. We're talking about digital media and social media, but you can't always produce the highest quality image because people may not have enough data to download those images. And the other thing I want to highlight under this is messengers. It's not always the influencer who is the best messenger. Sometimes it's a community health worker, or sometimes it's a religious leader, especially if it touches on matters of narratives, right? They are more powerful and they have influence in society. And finally, something I want to highlight is the adjacent topics, right? You can't just focus on family planning. You can't always focus on family planning on its own. It's good to ingest other topics that are relevant to the conversation, because sometimes people don't want to be faced with facts every day. They want you to inject a bit of fun into the conversation, or things that they like to engage in on a daily. Next, please. The pleasure approach. This is something that we
Sorry, and I'm just going to see if we can go a little bit faster. Apologies for Terry. We have one more speaker as well that I want to just give the opportunity to, but I don't want to take away too much of your time. So I just wanted to give a 2-minute or maybe just a 1-minute warning. Thank you.
Great. Okay, I'll try to speed it up. These are some of the content pieces that we have in various formats. And no, you can go to the next slide. It's okay. Yes, in various formats, and it also shows you how one piece of content can be repurposed in very different formats, in different tones, and for different audiences. Next slide, please. The toolkit is timely because Fome mentioned about misinformation and having a very good platform where you can actually go back with confidence and tell people, no, according to WHO, this is misinformation, this is the correct information. And just it being so simplified that the everyday content creator or influencer can actually take that information and adapt it in their local language. And anyone who is in the content creation space understands how much time it takes to just fact check and find evidence-based information. So I do feel this tool has come at a time when, it's needed because the influencers are growing, but at the same time, just ensuring that you make their work easier and they're disseminating quality information and the standards as well. Just make sure it's uniform. We can talk in different languages, but are we maintaining the highest quality standards? Finally, I think one more slide and then I'll be done. Yeah, I'm just going to highlight three things here. Best practices, it's simplifying the concept that you're sharing. And I think WHO has set a very good example with this and leveraging what's already working the platform. Sometimes innovation looks like understanding people are meeting at a certain place and you go there and make whatever intervention that you want them to adopt, part of their conversation and not necessarily building new ones. The other thing I want to highlight under this is that sometimes we oversimplify human behavior. It's a bit complicated. People don't have buttons. Giving information is not an end to itself, right? So just understanding that sometimes you have to show the conflict that people go through before making a decision, especially when you're having human interest stories being featured in conversations. And then selecting persuasive messengers, very, very important. And as I said, sometimes it's the healthcare provider who's best suited to share a message, or an influencer, or a religious leader. And finally, information and education, information provision in the digital media space can be repetitive. You could be talking about the effects of the IUD and someone goes back and asks, what is the IUD? So just being patient and realizing that, it can be very repetitive because sometimes people have missed bits and bits of information. That's really it from me. I hope you can get the presentation after just to go through, but thank you.
So much. So many insightful nuggets from you. Thank you. A lot of very wise words from this presentation. Thank you so much. And I'm very honored now to have our last panelist, Dr. Anna Sesi, who's an actual social media influencer with over millions of followers on TikTok. And so we're very privileged to have her and talk about her real experiences and being able to mediate information and social media. Over to you, Dr. Anna.
Thank you so much, Tejas, for the invitation, and congratulations to all the speakers here. Everything has been very valuable information, and I don't want to take a lot of your time because a lot of what everyone has already said is very accurate. So yeah, most people are looking for a lot of information on social media. Even younger populations are using TikTok as search engines for all kinds of health information. You can go to the next slide and the next one again. So yeah, I'm actually a medical doctor. I'm a medical geneticist, and I started doing social media because of the misinformation that everyone here has been talking about. So a lot of health practitioners ask if we should be on social media. And I always say, yes, we have to be on social media because people are looking up health information. They're looking up information about family planning. There's a lot of misinformation. And if we health workers don't take those places, someone else will, and they might be, we're risking misinformation. You can go to the next slide and the next one. This is mostly what Andy and Terry have been talking about. You can go to the next one. So something important also is it's not about the numbers. It's not about becoming viral or famous, but it's about having an impact. Whether it's an impact on an adolescent who is family planning, who we will be able to, so that she doesn't get pregnant when she's 14 or 15, that's a great impact. We don't need to get thousands or millions of views to have one person's life changed. And the next slide, please. So a great example of this was COVID. we already talked about this also, because there was a lot of misinformation there. And this also happens with family planning, right? There's a lot of myths, which is a great opportunity for content. Debunking myths is one of the greatest hooks for content, such as, does the after day pill make me infertile? Does the after day pill is it abortive, right? All of these hooks will be a good idea for content creation. You can go to the next one. And I'd like to tell you a little bit about my path and how you can start creating content if you're from an organization, an association, if you're a solo health worker or a solo person, educator, whatever it is. I want to encourage you to start creating content. And the worst content is the one you've created but you didn't post. So if you have any kind of content that's just sitting there, that's that you don't feel like posting, if it's true information, if it's evidence-based, please post it. You never know which post is going to go viral. The next one, please. So something really important is that we have to have the credentials about what we're talking about, right? So we can't, I wouldn't encourage someone who has no knowledge on this. I mean, this is also part of the toolkit that you'll get. This information is evidence-based, right? But we have to have the credentials. So how I started out on social media, I didn't start out as maybe as a student or in high school. No, I already had the credentials as a medical doctor. So we know that what's going to be posted needs to be evidence-based. We need to be continuing education. We need to be in health also. The next one, please. And something really important, even if you're an organization, an association, or whatever it is, you have to have a character. You have to have an identity. And this is what's going to differentiate users in social media that get lots of followers and that get a community. Maybe not lots of followers, but the community. It's the authenticity. Even if it's an organization, the organization has a branding, right? For the World Health Organization, it's going to be, maybe we won't be doing as much comedy because it's not what you would want to see as the World Health Organization. But if it's something else, I remember, I think the Washington Post was the one that had a great TikTok, right? Terry was talking about humor, and humor is always a great hook for this type of for creating social media. Of course, you can't use humor for everything, but we can use it for something. I actually have, I would like to share with you some of the contents I've created on family planning. And one of them, yeah, you can go to the next one and then the next one. It's actually not here, but I will send it to you on the chat. But one of them was like, what's the percentages of efficacy of the different contraceptives, right? And it was using this song that says, it's a Spanish song, and in the end it says like, being single is I think it says is popular or something like that. So people didn't know this was coming up in the song, and I would be like putting the like condom 78%, contraceptive pill this percentage, and all the percentage, and then in the end it was like the best one is like being single, which is not accurate, of course. But then in the text I would put like abstinence, right? Like that's the 100%. And then in the copy you can also put like the actual references and the actual information. But this, I mean, this was handy for like, people would watch it, they would laugh, it went viral, and they actually learned the percentages of efficacy of all the other contraceptives. Being with music, right? So using trending music will always be good. I also did some of myths, like, is the contraceptive pill abortive? Because this is something that goes a lot in Mexico. I'm not sure if in other countries. Then you can also, so something really important in the content creation, it can be storytelling, such as, I also have another one that's about like, so what is my contraceptive method? So everyone wants to know, like, okay, so she's a doctor. We want to know what probably the one she's using is the safest, or it's the best, or whatever. So that's a story tell. Then you can also always do question boxes, like ask me a question about contraceptive pills, or ask me a question about family planning, and then go from there. From question boxes, we get a lot of ideas, what the people are thinking. We always have to listen to the audience. The audience will give you the ideas for the content. And once you have the ideas, per se, the information that you want to put out, now it's the time to give it the way of putting it out. People want to be entertained on social media. If we just come out talking about, hey, this is the contraceptive pill and it's with levonorgestrel or whatever, this is not something that someone who's scrolling in their bed will be interested in. If we make it a little bit more dynamic, like, hey, if you're using the pill this way, you might be in risk of getting pregnant, and then talk about the importance of taking the pill at a certain time, at the same time every day, avoiding certain antibiotics. Like, the way you start the content, that will be the hook for the person to keep watching it. And also, I mean, that's one of the ways. Another way, of course, people, if someone is looking for some specific information on the search engine, they will find it. You can use hashtags to let the platform know what you're talking about. But yeah, that's the 3-second engagement, where we have to get a hook for the information that's gonna come out, right? Like, it could be like, what is the safest or most efficient contraceptive, and then talk about the actual content. So we have to be really aware that, unfortunately, people are looking to be entertained. And on the way, we need to educate. We need to give the information that we want to do. So yeah, as health practitioners, through social media, we can reach thousands, even millions. We can generate knowledge, battle misinformation, and grow knowledge on family planning. We have to be consuming content so that we can be aware, like stand on the user side and see what hooks are working for you, what content you kept looking at, so that you can create that same type of content, being it relevant for the information that we want to put out. Thank you so much, TJS. I think we can go along.
Thank you so much. Yeah, I
Thank
learned
you.
a lot. It was very, very interesting. Thank you so much for sharing your experiences. And thank you all for staying this long. I realize we are 15 minutes over, but we have over 100 people still. So really, really appreciate your indulgence with us and your patience. So we are now going to close. We will try to wrap up answering some of the questions. Unfortunately, I don't think we have time for any Q&A, but we will answer the questions in the chat, unless anyone has a burning question that they want to raise their hands for. Maybe we could take one, but otherwise, since we are over time, I don't want to extend that much further. And we will share all the materials after the webinar, including the actual link to the content repository, where you can actually get those simplified message banks that can then be repurposed for all these different purposes that we talked about on this webinar. So thank you so much to all the panelists. As part of the next steps, we will be translating this into various languages, and we also encourage further translation for local languages, for local relevance as well. We will make sure that the webinar link is going to be made available to all that registered, not just those that participated. Please, if you are interested in collaborating or discussing further, we would love to see how we can work together. Contact us at this email address, and the PowerPoint will be shared, so you'll be able to access it. And I will now hand it to Dr. Lale Sai for introducing the closing. Thank you very much to everyone and for your engagement.
Thank you very much, everyone, for joining us today for this important session. Thank you very much to all presenters who have contributed with their excellent presentations. And as part of this Navigating Truth in a Changing World series, today's webinar reminded us the challenge isn't just producing accurate family planning information, but it's actually making sure that people can find it, trust it, and use it. And we saw so many good examples in this webinar on this. This digital content repository is one of the tools to help close the gap, supporting providers, civil society, and digital actors in delivering clear, evidence-based messages across the platforms where users are actually looking for answers. We invite you to explore this tool, use it, adapt it, and share your feedback with us so that we continue improving it all together. And just to also highlight before finishing this webinar is just one part of the Navigating Truth in a Changing World series. Our next session in this series will be in September with a focus on civil society innovations in tackling misinformation. On behalf of our team and partners, I would like to thank you all again, and we look forward to continuing this work together with you. And thank you, Tigest, for moderation. Over.
Thank you. Thank you, everyone. Thank you to all the panelists, and we will share all the materials. Thank you so much. Have a great rest of the day. Thank you.